And I think, one of the things that I was really impressed to see was this data that's come out about the percentage of patients from the trial from SERENA-6 that actually had complete eradication of the ESR1 from their circulating tumor DNA. Something like 50% of patients that responded. Maybe speak a little bit about that and what you feel like that means in practice.
Right. So you're absolutely right. This was very exciting data from ASCO 26 when they did a report out that 50% of the patients had a median of 99% reduction in their ctDNA by
really
8 weeks.
Yeah.
By 2 months. And I think you and I were talking about this earlier, which is we want to understand who are going to be the patients early on who are going to do better than projected. People ask us this all the time in clinic, right? How do you know that I'm going to be the one that exceeds the median, right? The median average when they want to know what their life expectancy is like. And I think beyond a few other rudimentary and simplistic things, I think now we're becoming more fine-tuned and sophisticated in this way.
I love this 8 weeks. I mean, that's really, when you think about such a short time frame, especially when you think about an estrogen-driven cancer, generally we think about these cells as being, slightly less proliferative, and all of these things. It's not, the majority of these patients. And to see that in 8 weeks, that really speaks, I think, to the efficacy. It almost seems by 8 weeks, it's almost like a switching on and off is what it kind of feels like to me.
Right.
That by 8 weeks to be able to see that, it makes me think about potentially future strategies where, we're checking patients that if we know that the majority of patients that are going to get this great response do so early on, maybe that's a great way for us to identify patients that maybe won't get as much benefit and would be great candidates for novel therapies,
a different strategy,
trials. And again, it goes back to that idea, like what you were talking about, of empowerment, of being able to tell patients as we understand your cancer more and as it's evolving, how we're able to then maybe make better and smarter recommendations and individualize those recommendations for you and kind of your cancer.
Right. As you said earlier, 50% of the patients had total eradication, right?
Amazing.
And I do think, as opposed to the comparator arm who continued aromatase inhibitor, was only 2% of those patients achieved complete ctDNA clearance. And I do think that there are data now, and again, it's not fully hashed out in a phase 3 setting, but that does correlate likely with survival. And that's the big question.
Yeah.
But
you kind of can't see how could it not?
Right.
That is such a significant, we looked at time to response or time to measurable, RECIST response on imaging. It's rare we're able to see such dramatic responses by 8 weeks. That's, I feel like that's really exciting. I'm really excited by that data.